Welcome to today's Dentistry with Dr. Blanche Grube. The goal of our program is to educate you, the patient, in all aspects of the Huggins-Grube biological dental protocol. On this installment, we're discussing why you should not come to a Centers for Healing dental office. And now, here's Dr. Blanche.
This is going to be one of the most interesting lectures you have ever heard on my website, because Dr. Derek and I are going to try to convince you not to come and see us. That's right, you heard it. Do not come and see us. Unless you're really serious about getting healthy. If you just want to have beautiful teeth, there are 6,000 dentists in the state of Pennsylvania alone that can give you beautiful teeth, that do beautiful work.
That's correct.
Right?
There's some amazing dentistry.
Amazing. And they're really good.
Yes.
They're really good at what they do.
Right.
Am I saying that we're not good at what we do? No, that's not what I'm saying. What I'm saying is our purpose, our goal, our mission, our paradigm, where we're coming from, is so different than conventional dentistry. It's 180 degrees in the opposite direction, right?
Absolutely.
Okay?
Yes.
I mean, what are we all about?
How our mouth, what we put in the body, put in the teeth, affects the body.
How it affects your health.
Yeah.
Because there are dentists out there, 6,000 of them in the state of Pennsylvania alone, that do beautiful work. They do implants. They do gorgeous crowns. They do veneers, drop dead gorgeous. They'll even bleach your teeth.
Mm-hmm.
Make it look as white as this jacket, okay?
Mm-hmm.
With absolutely no consideration whatsoever to
The body and what it's doing
Right,
to the
you
blood,
got
the
it.
body chemistry, and
what it
everything.
does to the body. Exactly. So, we're here to tell you, don't come to our office if you want beautiful teeth, if you want to have your rotten teeth taken out and have a denture put in your mouth that feels just like your old teeth, because it's not going to happen. Don't come to see us if you just want to look gorgeous. That's not what we're all about. At Centers for Healing, we're about healing. We acknowledge the fact that there is a fairly large percent of the population, probably a good 25%, maybe more, that are very, very ill, very sick. And one of the contributing factors to their illness is the dentistry that they have received over the years.
right. And the key thing that Dr. Blanche said there was one of the contributing factors. We are not saying that it's the total factor.
Right.
So there's a myriad of other aspects involved in your health. So the mouth being one of them, and Dr. Blanche and I are blessed to be able to treat our patients the best that we can with what we know today.
So, you come to see us if you're interested in getting healthy, knowing full well that yes, you might lose a few teeth. As a matter of fact, you might lose a few teeth you weren't planning on losing, because we don't do root canals. A conventional dentist, if there's deep decay, they will not hesitate to say, you need a root canal.
Right.
Yeah, I love the word need,
Need.
right? Don't you?
Yes.
I need a Mercedes-Benz. I don't have one, but yeah, I need one, right? You need a root canal. All right, what do they mean by that? They mean that you need to keep your tooth at an expense, at a cost, and I'm not talking about money.
Mm-mm. Nope.
Nope, I'm talking about the cost to your health.
Right. And we ultimately leave it up to the patient. We give them
Right.
those options, and then they make the choice.
Right.
And some people choose their teeth over their health. And we have to live with that sometimes.
I heard somebody say it was a free country,
Right.
that people could make choices about their health. I'm not sure where I first heard that, but I did hear it. And I thought it was amusing, because it seems to me that our choices, the ability to make our choices about our health are being taken away from us.
Every day.
Every day. As a matter of fact, Benjamin Franklin wanted to put freedom of health choice, how you take care of yourself. He wanted to put that in the Constitution.
I didn't know that.
And Thomas Jefferson said to Ben, they were probably drinking a port, right? You know, a little port of beer or wine. They were great imbibers, they really were. Thomas Jefferson said, Ben, that's absurd. That's so obvious that people would have freedom of choice in health care. It's not necessary to put that in the Constitution. Can you imagine? Little did he know, in the year 2014, 2015, 2020, you know, you're not going to have your own choice in how your health is taken care of. And it's a shame that it was not put in the Constitution. Ben was
That's
right.
what we're seeing now, yes.
Ben was right. It should have been put in the Constitution. So let's get back to what we were saying about having to take some teeth out. Weston Price said that if decay was halfway the distance from the enamel to the pulp, well, you know, he's a dentist. Where's that on the tooth? Halfway between the enamel and the pulp. Yeah, that's right in the dentin.
That's right in the dentin, yeah.
That's right in the dentin, right? That's where most dentists actually see the cavity. Right? That's where most dentists say, yeah, you have a cavity, it has to get fixed. Well, Weston Price said that if the decay was halfway the distance, that pulp was already infected. And how did he know that? Well, he took slides and sliced teeth and looked under the microscope, and he could see the bugs were already marching to the pulp, 10 abreast. Okay? So that pulp was already infected. It's just a matter of time before the tooth dies. Thank God for most of us who have had cavities as a kid and have had cavities as teenagers. For most of us, that date when the tooth is going to die comes after we're already dead. And for some of us,
it doesn't.
It doesn't. That's right. For some of us, the tooth dies beforehand. In which case, a conventional dentist would say,
we need to get in there and
do a root canal.
Get that treated with the root canal and try to save that.
Right. And so we do not do root canals. And because we do not do root canals, we will stand on our head to try and save a tooth. But that is dead. That is dead. Once it's dead, it's dead. It deserves a funeral. So if you come to our office because you're interested in getting healthier, then you can probably expect that some of your very, very deep cavities will wind up being extractions, will wind up being teeth that have to come out. And as much as I love my partial denture, I really do. You know that? I don't even think about it.
I don't even know you have one.
Yeah, thank you. See? I love my partial denture. I sometimes brush my teeth and I go, oh, wait a minute, those are fake. I have to take them out and put them in the sink and finish brushing my teeth that I do have on top and put the denture back in. So I love my partial denture, but a lot of people don't.
Right. We see that every day.
We see that every day where patients say, well, the famous line is, it doesn't feel like my old teeth.
Right. It isn't.
No kidding.
No, right. Okay.
You know, we do the best we can, but it doesn't feel like your own teeth. So, if you want everything to feel like it did when you were 21 years old, if you want to look like a superstar, if you want to have the best smile the planet can afford, please don't come to us. There are 6,000 other dentists in the state of Pennsylvania alone that you could go to, and they will give you a beautiful smile. That's it for today. We're going to talk some more about this subject later on.
Thanks for being with us.
Thank you for watching another installment of Today's Dentistry with Dr. Blanche Grube. The goal of our program is to educate you, the patient, in all aspects of the Huggins-Grube Holistic Dental Protocol and how it offers dentistry that is safe for the whole body. Educate yourself. Watch the other informative and new patient videos right here on our website. Then call for an appointment at Centers for Healing.